morning, everyone. Again, myself, Dr. Atul Sharma, your guide of essential of sports injury prevention and rehabilitation. In this lecture, we are going to study about relevant anatomy of lower limb. In this, we first study about the our thigh bone, then tibia and fibula, that is our calf bone, tarsal bones, that is our ankle bones, and foot bone, that is metatarsal and phalangeal bones. In this, we again going to read about the muscles of our lower limb. So first we start the anatomy of lower limb. Femur muscle. Femur is the largest bone of our body, and with pelvic girdle it makes the hip joint, and with tibia and fibula it makes knee joint. This is the largest bone and of our body part. It has head, neck, shaft and condyles. One is medial and lateral condyles. Common problem is fracture of the shaft of femur bone. But fracture of femur is very serious. A fracture of femur accounts for 1 to 1.5 liter or more than that blood loss. Then comes our next bone, that is tibia and fibula. It is our calf bones. Tibia is our medial bone and slightly thicker. Fibula is thinner bone and lateral bone. The head of inner bone is tibia, that is medial bone, and the lateral bone is fibula. The lower end makes the medial malleoli, tibia, and lateral malleoli by the fibula, and it makes knee joint on the upper side and ankle joint on the lower side. Tarsal bone, it made up of talus, that is it's bit lying between the calcaneus and the talofibular joint. Calcaneus, then naviculars, cuneiforms. These are three bones: medial cuneiform, intermediate cuneiform, lateral cuneiform, and cuboid. And metatarsals and phalanges. Same like hand, the hand we lower limb has metatarsals and phalanges. Same for the great toe, only 2 phalanges are there, and rest of the fingers have 3 phalanges. The main function of our foot is weight bearing. Weight bearing occurs on 3-point system: heel, great toe and little toe. These transfers our entire body weight. So little toe has crucial role in the weight transfer of our body. Now comes muscles of the lower limb. Quadriceps muscles, these are the main extensors of the thigh. Quadriceps muscles, hamstring muscles, flexors of knee, main extensor of thigh mean knee joint, gluteal muscles, main extensor and abductors of hip joint. Gluteal muscles are three in number: gluteus maximus, gluteus medialis, and gluteus minimus. Then iliopsoas and rectus femoris, these are the main flexure of hip joint, and adductor muscles are main adductors of hip joints: adductor magnus and adductor intermedius. And then comes the muscles of our calf. Tibialis anterior, which do dorsiflexion and inversion of our foot. Tibialis posterior, which do plantar flexion and inversion. Peroneus longus and peroneus brevis, which causes eversion and plantar flexion. Then the gastrocolius, which are also known as heart of lower limb, second heart of our body. Plantar flexion of ankle and knee flexions. Now again I am going to repeat or revise you about the anatomy of lower limb. Femur bone, which is the largest bone, has a head, neck, shaft, medial and lateral condyle, tibia and fibula. The upper, it makes knee joint. In the lower, it makes the ankle joint. Tarsal bones, talus, calcaneus, navicular, cuneiform and cuboid. Cuneiforms are three bones: medial, intermediate and lateral. Metatarsal and phalanges, 5 in numbers. Great toe has 2 phalanges. Lateral other toes have 3 phalanges, and in the weight bearing, heel, great toe and little toe makes the weight bearing part of our foot. Muscles: quadriceps muscle, which is the main extensor of our knee. Hamstring, main flexure of our knee. Gluteal muscles are the main extensor and abductors of hip joint. Iliopsoas and rectus femoris, which is the main flexure of our hip joint, and adductor muscles are main adductors of hip joint. Tibialis anterior, tibialis posterior, the dorsiflexion and plantar flexion of our feet and inversion of our feet. Peroneus longus and brevis do plantar flexion and eversion, and gastrocolius do plantar flexion of ankle and little bit of knee flexion. Movements which occur on the lower limbs are at hip joint: flexion, extension, that is when you extend your hip joint; abduction, adduction, internal rotation and external rotation. At knee joint, mainly flexion and extension. When you flex little bit of your knee joint, then slightly medial and lateral rotation is also possible. And at ankle, there is only dorsiflexion, plantar flexion, inversion and eversion. So in this lecture, we had read about relevant anatomy of lower limb, the bones, muscles, joint movements. Now in the next lecture, we will study about the injuries of upper limb, common injuries of upper limb, common injuries of lower limb, and their causes, their biomechanics. So now I finish this lecture. Thank you so much.